was gonna say that I was gonna have this introduction of Trish, but knowing the reaction here, I think this is gonna be the shortest introduction. So, Trish was a former member here, active member for many years, and we're glad to have you back.
I'm gonna stumble through this. So, well, good morning, everyone. Thank you for the opportunity to be here this morning and to see all of you and just in awe every time I come to Rotary or civic organizations of the work that you do. So thank you for really making that difference in the community. So appreciate that work. As mentioned, I'm Trisha Creach, Executive Director of the Lake Regional Health Foundation. Prior to that, many of you know that I worked here, had the opportunity to serve in the capacity of the Director of the Camden Chamber of Commerce. Absolutely love this community and just amazing things happening in Camden throughout the Lake area. So now I get to serve as the and for a long time, it was Director of Philanthropy, but when people they're like, how do you spell it? So I just became Executive Director of the Health Foundation. So, and then people often look to me and say, oh, you're the fundraiser. I don't like to think of myself as a fundraiser. Basically, I'm the health connector and sharing the message and the story about Lake Regional, the great things that are happening today and tomorrow, and getting people excited to want to be a part of it and helping us transform healthcare for all of us, our family, friends, and you know, healthcare is one of those things that it's something one of these days everyone will need. You may not have a primary care provider, you may not see a doctor on a regular basis, but sometime in your lifetime, in your family's lifetime, you will healthcare. But before we can begin, I jump into the presentation. I have a few numbers that I'm going to invite you guys to share what you think some of our numbers we have at Lake Regional. Oh, there we go. There we go. What did you do? Okay, well, absolutely. So did anyone want to guess how many guest patients, visitors we have come through the emergency department every year?
38,000.
Did you see that? Oh, you did. Oh my God. I need to do the football thing. So when you think about 38,000 people, that's half of Arrowhead Stadium coming through the emergency department each year. Some of the large, even metro hospitals, metropolitan. I'm sure you probably have like and so it's just amazing, especially during the summer months, to be able. It is incredible, and in the summer months, you know, they utilize all space possible. And so one thing that Lake Regional continues to do is to train the team if there was a major catastrophe or major casualties coming off the water at a boat race or any of those, being able to prepare the team for a mass number of folks coming through the door, because 38,000 is an impressive number to begin with. So, perfect, 38,000. Okay, next question. How many clinic visits? How many people do you think come and visit our clinics each year?
Let's go 4 times that. 20,000.
250,000, well, a little over 250,000. Yes, a little over 250,000 come through our clinic each and every year, and that doesn't even include our express care. That's strictly going to visit with well checks and visit primary care. Okay. Oh no, okay. So outpatient visits, those that are coming in to have an outpatient surgery or procedure that does not require them staying overnight, over 330,000 of those on an annual basis. Okay, babies delivered. 225.
400.
And when you put in relationship to 365 days in a year, 5,700, you're getting close.
600.
So yeah, you're up to 600, you're getting even closer. 712. 652. And so when you think about that, that's 1 point, I think it's say 1.7 babies per day. But a little, almost 2 babies a day are born like regional. Okay, we talked about express care. How many people think that you think visit the express care on an annual basis?
Well,
How many? 1,200? Sorry, 43,000. So we think about every person in the county going to the express care at one time throughout the year. And so, sharing these numbers, you look at it that there's a small team that is really, working to make first and foremost safety, make be comfortable and make it as convenient as possible. So, just amazing.
do you know how many of them are individuals versus folks?
Yeah. One thing about the express care, I'll say this, and it doesn't directly answer your question, is that people don't want to go through the emergency department. That was the whole model behind express care. And then many do not have health insurance, so they utilize the express care services. I know there's a number of people that go through multiple times, and especially with family, kids go through, and then the next week after that, there's another bug out in the community that, they go through express care. I don't know what the repeat is on that, but I can. How many express cares? 3. So, OC Beach had an express care right there next to the hospital, but it was closed. One of the reoccurring comments that we heard was that express care was shared with the primary care physicians. And so you had kids coming in for their well checks, and then and this kind of evolved during COVID, and then you had people coming in with COVID. And so you were intermingling these two populations, which that was one of the many comments of patient satisfiers was, mixing these populations, bringing my child in just to see how much they've grown. And then we have people over here that are COVID or other illnesses. So, OC Beach, it closed, but we still have Elden, Camden, then recently. New facility in London. So Lake Regional Health System, many of you may know this, but in case you don't, it is we are a level 3 trauma center, level 2 STEMI center, which is heart, and then a level 2 stroke center. So we're the only hospital between Springfield and Columbia that is designated for those 3 areas and really focusing on those time critical diagnoses. So these are 3 areas that I know Lake Regional takes great pride in delivering care. In fact, there was a patient that was a second homeowner, started feeling a little ill. He comes up to the light. Well, he was sharing with his wife because I think I had a heart attack. He comes up to the light there at HH. And he said, left would take me to Columbia, right would take me to Lake Regional. And his wife was, gotta go left. He said, we don't have time. You've got to get me to the hospital and get me to the hospital now. And he's a grateful patient today because he had no idea, he had no experience as a second homeowner with Lake Regional. But once he got there, and I'll share with you coming up just some of the door to balloon or door to needle line and opening up patients and hearing that blockage. So it's just amazing the numbers there at Lake Regional. So the areas of focus that Lake Regional has been really spending a lot of time and feel this is very important today and into the future is quality care, having exceptional care for all who come through the doors. Provider recruitment, when we expanded into Lebanon, that helped with scale. Just the population of this area alone didn't warrant 2 urologists, but when you add on another community, it doubled our service area to where you could look at having 2 urologists instead of 1. So it really helps us to recruit more physicians, and it's amazing that those that are living in the city, when we share a little piece of our heaven here, it always helps with physician recruitment to be able to have a community hospital and to live in a community that so many people just come on vacation and enjoy, but to call this place home. Market expansion, mentioned about Lebanon and the expanding healthcare services in that community. Just recently launched the home health and hospice. Opened a clinic there in May, and then moving on to now phase 2 in the Lebanon community. And then community commitment. Lake Regional is committed to the community in a number of ways, and I'll share more information that when we talk about our community contributions that are given each year. So I want to share with you a video just to talk about the level of care, and the gentleman that you're going to see is a face that I know many of you know. But I think this really sums it up as far as the capabilities and what's happening. Hopefully this will work.
So, also, that maybe say line, that maybe it's a finger, a fish or finger, and maybe helps make sense out of helping have a problem. Finding type of problems along that position. So, hospital, very small hospitals, but all basically services here in the hospital. Hospital. Still service stress, travel, tire, people, bring space or very firm. Strives to continue to grow the services that we provide.
So you might recognize that face, Dr. Cooper, who is second generation again. There we go. So Doc Cooper is in charge of our emergency services and emergency department. If you have an opportunity on the non-patient side to come to our emergency department, and if you know him, you talk about an amazing individual. But you know, if you don't know him, I encourage you to meet him. If you come into the emergency department, you're, you know, Doc Cooper or any of the hospitalists, they're there to take care of you. Just an amazing emergency department. And he still has a smile on his face after 38,000 people that come through the door. So amazing individual. So that message is shown. As I mentioned, with our 3 express care clinics, we also have 7 primary care clinics. We have our specialty locations. We also have our retail pharmacies, our rehab, and our home health and hospice. Areas of focus and our service lines, our heart care, orthopedics, cancer care, and mental health. There's been some discussion about pediatrics, but we're just not, we're not at that level today. But you know, who knows what the future may bring as far as developing pediatric care. So talking about the quality care, we are so pleased to be able to share the Joint Commission's Gold Seal approval, both for the heart check and through our stroke program. And as I mentioned earlier, as far as if you come into the door and all signs are in the middle of having a stroke, from the time you hit the door to the time they open up to clear that blockage, 37.1 minutes, which the national benchmark, as you can see, is 60 minutes. So what is so critical about that is if you come in through an ambulance, they're already prepared. So when you hit that door, you're not waiting in a room and they already know what's happening, and they get you in right away. And the same goes for heart attack. The median door to balloon time is 43 minutes, where the national benchmark is 90. As you can see, I don't work in the IT or AV department, so thank goodness. This year we are pleased. So this year we are pleased. Oh, I guess it's on your computer. Oh, to announce that Lake Regional Health System received the Joint Commission Sepsis Disease certification. We're the first hospital in the state of Missouri. And if you're not familiar with sepsis, it's non-clinical. I'll say it's a really bad infection. And when someone comes in sepsis, they, you know, it progresses if you're not on top of it, and it can shut down organs. And it's a very, very serious situation if you're sepsis. So to be the first certified in the state of Missouri is something that we are very proud of and celebrating with the team. Areas of, I mentioned earlier, of focus, provider recruitment. Since March of last year, I've added, I think that's actually closer to 25 providers, but recruitment continues. You know, we want it to be when you call, if you utilize like regional services, when you call, you're not waiting months to see whether it's primary or specialty physician that we can get you in. But physician recruitment occurs every day, and as you may have read, the pressures of healthcare and what's going on. You know, Lake Regional is unique because a lot of community hospitals are closing their doors. Lake Regional is financially strong, stable organization, and so we take a lot of pride in that. And we want to continue that well into the future. So as I mentioned earlier, market expansion, we did expand. We've been in the Lebanon market in part of the old Detroit Tool building. And so in May of this year, we opened the doors to the Lebanon campus, which includes the primary care providers. There is the express care at that location, also occupational medicine in that community. And they have large manufacturing, large industry. So occupational medicine for the business customers and imaging. We also have been able to expand some of the specialty services in that community, that you can see the heart care, gastro, mentioned Ahmed, orthopedics, pulmonary, and women's health. So we have providers that are at Lake Regional or in the community that go down and provide services a day or two throughout the week. So community.
Primary care and express care.
Different doors, yeah, different locations. So, yeah, the very first week, we had a gentleman who came in and was in full-blown heart attack, thinking he could come through the express care. And so he, actually, you know, when he went down, it was just, you know, fortunately, Mercy is right there, on the corner, was able to call and get him to so, yeah, so it's, you know, express care covers a lot, but some of those time critical, you know, episodes are ones that they needed advanced care. So, in other locations. So, community impact. So, in fiscal year 23, Lake Regional contributed, a little over almost 33 million to the community. So whether it's charity care or someone was unable to pay their bills, we also have a number of scholarships that are given. We provide the trainers with the sports physicals, and then we strive and work very hard to stay connected to as many community organizations, chambers of commerce, in the communities that we serve. And also the numbers as far as employees, we have more than 1,200 full-time employees. And you can see that salaries and wages and employee benefits that come with that number. And for the second year in a row, we're proud to say that we have been selected as Forbes America's Best In-State Employers. And so that is something that we are very proud of. And we didn't pay to be a part of that survey. They surveyed over 70,000 individuals throughout the country, and Lake Regional has now made that for a second year. So what does healthcare look like after post-COVID and economy? So Kevin McRoberts, you'll hear him say this a number of times, our CEO, that we're recession-proof, we're just not inflation-proof. So since 2020, we've seen a 20% increase in not only labor, but supplies and drugs. And so being able to adjust and when you extend Medicare to Medicaid, there's just a threshold of what you were given. Anything above that, you're on your own. So be able to cover those costs. They don't take into account all the the drastic increases. So that is why. Oh, let me one more slide. Is as I mentioned, we're a nonprofit hospital, and so my job is to share the story, get people excited about what is happening at Lake Regional, and it's just some of the amazing some of the work that is going on. So, am I running close to time? Okay, I'll speed this up. So through this, this year that couple there, for the first time in the history of Lake Regional, we had $1 million donor, which I really think that I'm not speechless, but when he said what he was giving it to us this year, we did that there and we had no words because we were so taken by just the generosity. But at the end of the day, they believed in Lake Regional, and that's what it's about. They believed in, when they went to the pharmacy, it was their prescription was correct. When they met with their primary care doctor, it was exceptional care. When they had a procedure done, they knew they had the best team working with them. So that is something that so we were thrilled and more to come. So my job is working on behalf of the Health Foundation and really putting together a sustainable philanthropic strategy for Lake Regional.
No, I was just
Okay.
clicking the button, I didn't know what it did.
Okay, right. So when a donation comes into Lake Regionals, there's 3 areas today where those donations come in. One is our capital campaign. We're working on the outpatient surgery center there in Lebanon, which is phase 2. Annual gifts, cancer care, heart care, all anything that falls under the mission of care, that is that middle area. And then our endowment, that is something that we'll start talking more as far as plan giving and really growing that endowment to have that rainy day fund when, which we hope we never see another COVID, but we're prepared if those resources, with those resources when they're available. As I mentioned, I'll make this really quick. Lebanon Capital Campaign, as mentioned, we opened the Lebanon campus for patient-centered care at one convenient location. The first phase was a $13 million investment. We are moving to construction phase of phase 2, and that is to bring a outpatient surgery center, which will be strictly outpatient. But the amazing thing is there's a robotic assisted piece of technology that is at Lake Regional now that physicians are being trained on, that you could go in the morning, have a total joint replacement in your knees, and be home for dinner that same day. It's an amazing piece of equipment. And if there's ever an opportunity that if you're looking for a place to meet, to maybe even do a tour so you can see this Belsys machine, please let us know. It's just a really cool toy. I mean, I shouldn't say toy, it's not a toy, but I mean, it's just an amazing piece of equipment that does amazing work. So then you go home the same day. And that will be at Lebanon. Once Lebanon is open and established, then the hospital will also have a Belsys machine located there. The Lebanon Capital Campaign is a $5 million campaign, but that will bring our total investment to that community over $32 million. And I'll end with this. You know, our slogan is our commitment to caring, and I'm going to share a video with you that truly hits that point home. David Ludwig came in the middle of a heart attack, and I just want to share with you some of his comments of the services received.
What about that day is came home about 9 o'clock, 9:30. 20 minutes later, it hit me. I was experiencing pains on a scale of 1 to 10. It was 50. So by the time we got to the hospital, I went from just take me because I couldn't stand the pain anymore, to fear what's going to happen with my wife. Is she going to be okay? And then the next thing I know, I woke up in ICU. Not really knowing what happened.
They always say time is muscle. The earlier we treat, the less the damage. We tried also in saying that we have one of the shortest durable time. That means we're able to save their muscle as quickly as possible.
The next day when I woke up, I just felt, because of the expertise that Lake Region provided, I was able to get through that. Walking in the house through this door here, all my kids and grandkids were standing over to my left. First reaction I saw was just down in tears. Just being so thankful for getting another chance on life.
Satisfaction for me in my life, you know, the relief I see in patients after they have had a heart attack, looking at their face afterwards, and then going into the it's fine.
Measure success. It's not here talking right now. Like we all gave the second chance.
So that video is so amazing when you share it in different settings, because oftentimes, Dave, will come with me. And so they see the video and then you introduce Dave and he's just incredible, a grateful patient, beautiful family, and just really cannot praise Regional enough for the work that they do in saving his life. So with that, I'm sorry about the AV issues and working through, but do you have any questions for me?
Just make a quick comment that, showing my age here, John will remember this. I remember when we, in the closest hospital years ago, we either had to let on the treacherous road on Highway 5, or you went to Jeff City. There was nothing.
Absolutely, and so Lake Regional is celebrating this year the 45th anniversary, and in talking with Larry Shields and those that were part of building the hospital, you know, they said they had to partner with the community to bring healthcare services. It was Lake General Hospital, and they said they partnered with a funeral home for ambulance service. So can you only imagine calling an ambulance and having the funeral hearse show up in your driveway to transport you? Not the best image, but you did what you had to do in order. And I know Gary and John have been involved with Lake Regional and have great history and really building the foundation to what Lake Regional is today. So thank you both, and thank you Rotary for supporting Lake Regional and the work that is going on. So we're excited. The next 3 to 5 years, you're going to see even a different Lake Regional than it is today. Some amazing things that are happening at Lake Regional. Real quick, moving some of the outpatient services over into the shopping center across the street. The Old Woods Halls will become an outpatient center. Patients come in and do a 6-minute breathing test, but now when they park in the parking lot, they walk in the door, they catch the elevator, they go up to the second floor, they go down a long hall. They've already done their 6-minute breathing test, and they're already winded by the time they get there. So being able to pull those services out to where you park in the car, park at the door, and you walk in. And then also Meditech Expanse is I don't know if you've had to work with the different portals. You have your clinic and you have your hospital, and it's just been a real challenge. So all of that will be in one location. So when you come in the hospital, they'll already know the medications that you're taking, whether you've gone through the clinic. All that information is at one location. So and that is coming go live. I believe the go live date is in May of next year. So it's a process, but it's a rolling. So it's not like everybody gets changed in one day, because that would cause, you know, major blackouts and probably shut everything down. So we'll just bring on the clinics and hospital and online graduate process. But I do want to share with you too, we have provider directories, which are our new directories for this fall. We have our annual report, so you can see some of the more statistics. And then hot off the press, we have our 2024 calendar, which is going quickly. And then our team there at Lake Regional, they take the photos, and then it goes through a jury selection of which photos actually get in the calendar. So please help yourself to those calendars. And also, I do have more of these. If anyone would like those, they're the temporal thermometer, but they're just great to have in the car, Band-Aid, all of that. So please help yourself to those as well. So it's been a pleasure, and Merry Christmas, but I'll see you all.